Recording in progress.
I'm Mike Sharland, General Member of the Governing Council and Chair of the Membership Task Force, here interviewing Dr. Jill Isenberg for a member spotlight. So, Dr. Isenberg, tell us a little bit about your practice.
Sure. I'm a pediatric neuropsychologist at Essentia Health in Duluth. I've been a pediatric neuropsychologist since 2007, and I have been at Essentia since 2015. I work with children between the ages of 3 years and into young adulthood. So 22 is about the oldest patient that I evaluate.
Excellent. Well, tell us about one aspect of your job that you love the most.
I see assessments as like a little investigation or mini science experiments. And so we have hypotheses about a child's functioning, we collect the data, and then we use that information to refine our hypotheses and draw some conclusions. And so I always find it thrilling when we are able to find conclusions that really help move children forward, whether in education or understanding their social functioning or just being a parent's ability to parent their child really well. So when you do those feedbacks and the parents and you are really connecting around these conclusions about the child, it's just a really rewarding feeling. That's my favorite thing.
Excellent. What is the last good book that you read in the field?
Well, I would say this is not the last book I read. It's kind of an old one, but it's one that I found really just pivotal in my career. And that was Feedback That Sticks by Karen Postal and Kira Armstrong. It's a fabulous book that talks a lot about feedback as an intervention, which I think is a really interesting way to think about feedback, and talks a lot about how to word our findings in ways that are easy to understand and relatable to families and to the individual who had the testing. And it's a book that I go back to repeatedly. It's one of the few books that I find I reach for often to come up with new ideas or new ways to talk about difficult things.
Excellent. Last couple of questions. Why did you join MPA?
Well, you, Dr. Sharland, encouraged me to join MPA. I think recognizing the advocacy work that MPA does on behalf of psychologists, in terms of the legislature and other ways that they advocate. And I opted when I joined to participate on the conference committee. And it was so fun. I had a really good time helping to plan the conference 2 years ago, the one that was back in person after COVID, and that I helped with the most recent one. And it's just been a great way to meet psychologists who aren't neuropsychologists, who don't work in my area, my geographic area, my practice area, and just get to know more people across the state. And it's been a really great experience.
Excellent. And last question for you. If you couldn't be a psychologist, what would you be?
So I think I would work in hospitality, like running a bed and breakfast or a hotel or a restaurant. And I think because ultimately, I think part of what being a psychologist is about making people feel comfortable, making them feel welcome so that they can be in an environment where they feel heard. And I think, the same thing where you're running a boutique hotel or a bed and breakfast, it's about making people feel comfortable and welcome and like they're in a safe place. And so I think I could see myself applying those skills and the things that I enjoy about being a psychologist to that kind of a setting.
Excellent. Well, Dr. Isenberg, thank you for taking time out of your busy schedule to chat with me and to agree to this member spotlight.
Well, my pleasure. Thank you for having me.
All right. Take care.